Hi students, once again I'm meeting you to talk about the lesson, that is drug abuse, also alcohol abuse. We have talked about the different types of drugs applied from different types of plants, the source. So most of the drugs are alkaloids in nature. They are alkaloids in nature, that is the chemical nature mostly except one or two. Now we have to talk about addiction leading to dependence on drugs. Also alcohol. What is addiction? So it is nothing but the physical and physiological dependence to alcohol and drugs. This is called addiction, generally speaking. Physical and physiological dependence. Physical dependence related to the body. Psychological dependence related to the mind. Okay, now what is addiction? It is a physical or psychological just a need to do or take or use certain substances. For example, alcohol. So, to a point, it could be harmful to a person. If you are taking alcohol in a small concentration, small amount, nothing would happen. If a person is going on drinking alcohol for a long time, the continuous intake of alcohol could be harmful to the person. At that time, the process is called addiction. Now, the person is addicted to alcohol or any other drugs. That's why I said here, to a point, it could be harmful to an individual. When it starts its actually expression in the individual's body, physically and mentally, that should be harmful. Then at that time, it is called addiction. Now, this addictive behavior can be destructive in nature. This addictive behavior can be personally destructive to a person. So, it causes destruction in his life activities. Not only the mind, not only the physical nature of the body, but also the person loses many things, and that is called destructive. So, this addictive behavior can be personally destructive to a person. Now, what are the effects of this addiction? Suppose a person is going on just actually drinking alcohol. He is called overtime addicts to alcohol. Overtime addicts. Going on drinking alcohol or actually any drug. So he is called overtime addicts. So these overtime addicts start to lose not only their jobs, their homes, but also their money, but also their friendship and also family relationship. Even just losing contact with the normal world. There is no association. There is no integration between him and the society. He is being neglected. He is keeping himself away from that one. That's the first effort. Losing jobs, money, homes, and also you see that one, the friendship, the family relationship, and contact with the entire normal world. So, addiction to alcohol leads to certain development, certain psychological attachment to certain behaviors or certain what is called effects, we can see. And that is called euphoria. I mentioned already euphoria. Euphoria is a condition in which the person is thinking that he is in well-being condition. He is not losing anything. His mind is in a setup that he is not losing anything. He is in a temporary feeling of well-being. That condition is called what is known as euphoria. So addiction to alcohol leads to psychological attachment to certain effects. What effects? You have one condition, euphoria. I mentioned about this euphoria by talked about that is what is called the cannabinoids abuse of drugs, just like marijuana, etc. All lead towards the euphoric condition. So it is a kind of what's called temporary feeling of well-being. He is having a false feeling that he is in a state of well-being, but he is in a abnormal condition. But he doesn't know about it, what he has in his mind or in the body. So there is a second effect, it is euphoria. The first one, losing money, losing jobs, losing home, etc. The second one just leads to psychological attachment to certain effects such as euphoria and temporary feeling of well-being. Now let's pass on to the next effect related to addiction. Repeated use of alcohol and drugs affect the receptors in the body. What receptors? The tolerance level of receptors. We have certain receptors in the body, they can tolerate only certain level of what is called alcohol and then drug to be consumed. If it is beyond that level, then these tolerance level of receptors are affected. Then what would happen? The receptors then respond to higher doses of alcohol and drug, leading to greater intake of alcohol and drug and addiction. So the rate of addiction increases. So because the receptors are responding just like medicine. If you are going on taking medicine for a simple one, higher doses needed. So always take only the lowest level. If it is being repeated again and again at one stage, the tolerance level to the drug or the tablet will be affected. So here, that is the receptors that respond to only higher doses of alcohol and drugs, leading to what will happen to greater intake and addiction. So excessive use of alcohol and drugs results in or leads to what would happen? Physical and psychological dependence. Physical and psychological dependence to the drug. Without drug or alcohol, it cannot survive. Such a feeling, a false feeling, he develops or she develops. So, that is what is called psychological dependence and physical dependence to what is called alcohol. I'll tell you what it means by physical dependence. Psychological dependence, mentally is always interested to have a drug. Without drug, it cannot survive. That's a feeling in his or her mind. Now the fifth one, euphoria. When the psychological dependence develops, what will happen? The drug user gets mentally hooked on to the drug. So that is called psychological dependence. He needs a drug, then only he can survive. That is hooked on, captured, hooked on to the drug. The drug captures that person mentally. So that the person needs drug, what is called continuously. Now, the user always thinks only about the drug. That is what happens. And there's continuous and controllable craving to drug. This condition is called euphoria. When a person has actually continuous thinking, has uncontrollable craving to drink, just actually thinking about and also needs the drug, just craving to drug, just eagerly waiting for it. That is called craving for drug. So that condition is called euphoria. So this state is called euphoria when a person is having uncontrollable craving for drug. So this condition is characterized by mental and emotional preoccupation with the drug, mental and physical preoccupation with the drug. He needs drug physically as well as mentally. He is ready to have only the drugs, not any other thing. That's called preoccupation with the drug. So that is the result of euphoria. So we have to go for the next one, what is withdrawal symptom, etc. I said euphoria is characterized by mental and physical preoccupation with the drug. Now the next key effect, physical dependence. So we have seen already the psychological dependence. The person is mentally hooked on to the drug. And that is a condition. He needs drug just mentally, thinking that without drug he cannot survive. Now what is physical dependence? It is a state in which the user's body requires continuous presence of drug or alcohol. So there is a mental requirement. Now this is the body requirement. It is a state in which the user's body requires continuous presence of drug or alcohol. This is called physical dependence. Now what do you mean by withdrawal symptom? If a person is going on drinking alcohol or any other drug, if the intake of alcohol or drug is abruptly stopped, the person may develop certain symptoms, and these symptoms together called withdrawal symptoms. In a sense, the person or user is in a confused body state, and also actually protest against the absence of drug. You protest anything, anybody. So because of the absence of drug, because you stopped drinking, the person get agitated and protest against the absence of drug. He needs badly the drug. If it is not given, even to the extent of attacking anybody. That is called what is known as a protest against the absence of drug. Now we have a number of withdrawal symptoms. So the withdrawal symptoms may range from, say an example of mild tremors to, say an example of convulsions, what we have the fits, rapid contraction and relaxation of the body, severe agitation and fits, and other things. I will write down on the board just what are the withdrawal symptoms the person develops when he just stops drinking or stops actually taking the drug. And at times he develops certain symptoms. It is uncontrollable. It is uncontrollable by anybody. Only when the person thinks he can control. Otherwise, it is uncontrollable. The person is having some sort of depressed mood, anxiety, irritability, what we call sleepless night, etc. Now we'll see what are the withdrawal symptoms. Because of the abrupt stopping of intake of alcohol, the person may develop the following symptoms. It ranges from 1. Mild tremor to convulsion, the shaking of the body, and then convulsions, rapid twitching of the muscles. Severe agitation and fits. Fits also more or less related to what is called convulsions, otherwise called epilepsy. Rapid twitching of the body, and also other symptoms related to the muscular rapid contractions. Depressed mood, anxiety, always expecting something, irritability, get irritated, and nervousness, shivering, restlessness, insomnia, sleeplessness, and dryness of throat. The throat becomes dry, depending on the nature of the drug. So these are the different symptoms what we have developed, that is because of withdrawal symptoms, because of the withdrawal of what is called sudden or abruptly stopping the alcohol, abruptly stopping the intake of alcohol, that results in withdrawal symptoms. Now we have to go for the effects of alcohol and the drug. What are the effects of alcohol and drugs? We have both short-term and long-term effects. Now, what do you mean by short-term effects? The short-term effects normally appear only for a few minutes after the intake of alcohol and drug. What happens? The drug abuser feels a false sense of what is called well-being. He is in a well-being state and a pleasant drowsiness. This is what is happening. The drug abuser feels a false sense of well-being. He is thinking that he is in right position, right place, in well-being state. And pleasant drowsiness. He feels pleasant, actually that's mentally just feels pleasure. Now what are the short-term effects? Number 1, euphoria. So I mentioned already what we have, a sense of well-being, a temporary sense of well-being condition. Then pain. This is because of the continuous intake. Dullness of senses. The different senses are not responding properly. Either what is called the eyesight or the hearing or any of the senses. Alteration in behavior is not a normal behavior, he is behaving differently. Blood pressure. The pressure of the blood is shooting up. The narcosis. So we are using morphine, that is the painkiller, not only for killing the pain and making the person to go for sleep. So narcosis, the condition of deep sleep. And then nausea, a feeling, a kind of sickness with a sense of vomiting, but there is no vomiting. So it is a kind of sickness with an urge to vomit, that is called nausea, and then real vomiting. This is because of the acidity in the stomach, etc. These are the short-term effects. We also have long-term effects which cause serious damages. This is because of constant excessive use. So when the drug user is affected, that is both physically and mentally, so his life is in threatened state. So his life, or it makes normally, see that for the drug abuse, makes the person's life unbearable and torturous. For example, the brain as well as, you know that when the liver damage occurs in the case of people who are drinking continuously. So that's about the serious damage because of the long-term effect. Because of the long-term effect. So the drug user is mentally and physically affected, and which affects the life of an individual unbearable and torturous. So long-term effects results in liver damage as well as what we have the brain damage. Okay, now what is happening when the alcohol is being taken during the adolescence period? So the use of alcohol during adolescence have long-term effects. What are the long-term effects that occur due to intake of alcohol or drug during adolescence period? Now let's see. Now the effects we have talked about so far, the short-term effects. Now we have to go for long-term effects. Drugs and alcohol has long-term effects that cause serious damages. What's the reason for serious damages? Because of one, constant use and excessive use. Second one, constant excessive use of alcohol causes serious damage that leads to long-term effects. So physical and mental disturbances makes the life of the user unbearable and torturous. For example, heavy drinking may cause permanent damage to the liver and brain. That's about what we call the long-term effects, generally speaking. Suppose, if you're taking the adolescent period, what are the effects of use of alcohol during adolescence? So the use of alcohol during adolescence normally has long-term effects. The following are some of the long-term effects caused in adolescence period because of intake of alcohol or any other drug. Now let's see one by one. Now the next one, effects of alcohol and drugs during adolescence. The use of alcohol or drug during adolescence normally has long-term effects. What are the effects? Long-term effects means it's persisting for a long time, affecting or causing damage to the various organs. Now the liver cirrhosis is the most common disease which is affected because of alcoholism. So what happens? The alcohol, so the liver is a place of breakdown of fat. Alcohol interferes the ability of liver to break down fat. So the fat accumulates. So the overtime accumulation of fat, and also the liver is a place where the alcohol is being broken down into harmless substances. So we have, because of the liver function stop abrupted, what will happen? We have the accumulation of fats as well as high level of alcohol. And these two factors damage the liver cells. As a result, what is happening? Scar tissues grow. Scar tissues means functionless tissues to just replace the dead cells, the liver cells. And this condition is called what is known as liver cirrhosis. The scarring of the liver. Scarring means the glandular cells are replaced by what is called abnormal tissues. That is nothing but what is known as the scarring tissues, fibrous tissues. So also we have what is called fatty liver syndrome. The liver enlarges due to non-function because of the accumulation of fat, because of the high content of alcohol and other products. So one of the just effects during adolescence because of the intake of alcohol, that is liver cirrhosis. And the second one, when you're taking alcohol, it irritates the lining of the stomach and stimulates the production of more hydrochloric acid. And such a condition results in what's called ulcers. So, stimulation of hydrochloric acid, which causes irritation to the wall of the stomach, particularly the mucous layer of the stomach, the erosion of the mucous layer that results in what is called ulcers. And also if you are just taking alcohol continuously, the excess of use of alcohol normally weakens the heart muscle. So here also we have the dead cell, so scar tissues grow to build up in the cardiac muscle fibers. So this is what is happening just as a result of this one. When a person is heavy drinking or heavy drinkers are supposed to have the risk of heart attack, blood pressure, coronary artery disease, stroke, etc. I will write down in the board the next one. So increased intake of alcohol normally causes the increased risk of the diseases, mainly the heart diseases, heart attack, blood pressure, coronary artery diseases, the stroke related to the brain. Okay, let's take it now. What are the other effects of using alcohol during adolescence? So heavy drinkers have an increased risk of heart diseases. Particularly, you see that one, blood pressure increases, the stroke, that is affecting the what is called actually the brain, cerebral thrombosis, clotting in the brain vessels results in stroke, heart attack, and coronary artery diseases. We have a number of coronary artery diseases, for example, myocardial infarction, etc., all because of the clotting in the coronary blood vessels. And that's about we have the heart problems related to, that is, the drug abuse. Now the next one, Korsakoff syndrome, is also what we have a question in entrance paper. So it's the most commonly caused chronic memory disorder affecting the memory loss occurs in the case of Korsakoff syndrome. We have Wernicke's encephalopathy is also related to Wernicke's encephalopathy. Just the person is unable to differentiate what is called just the writing letters and then what is the reading. That is what is called Wernicke's encephalopathy. Now the main cause of Korsakoff syndrome, that is because of alcohol misuse. This is the primary syndrome. Another secondary, just actually there is a factor responsible for the Korsakoff syndrome, deficiency of vitamin B1, that is thiamine. Deficiency of vitamin B1, thiamine. So primary cause, alcohol misuse. Secondary cause, deficiency of vitamin B1, thiamine. Okay, what are the symptoms? I mentioned already, loss of memory, amnesia, difficulty to learn, unable to differentiate, hallucination. I mentioned already, illusion of just hearing or seeing something, but something is not there. Sight disturbances, vision disturbance. These are all some of the impacts of Korsakoff syndrome because of the misuse of alcohol. The secondary factor causing Korsakoff syndrome is nothing but deficiency of vitamin B1 thiamine. Now we have to go for the different prevention and controlling measures. Prevention and controlling measures related to drug abuse. Okay. Now you see that how to prevent and control the drug abuse and alcohol abuse. It is practically possible to prevent someone from the use of alcohol and the drugs. The following are the measures adapted just to prevent and control alcohol and drug abuse. Number one, effectively dealing with the peer pressure. So one of the reasons for the teens, for example the age group between 12 to 19, to start alcohol is due to friends or the peer groups. They are imposing pressure on them to take alcohol, to take what is called the drug. That is the pressure that is created by the peer groups that is on a normal person. So it is very important to have better group of friends to avoid such harmful alcohol and the drugs. This is number one. And seeking help from parents and peers. Peer groups. So it is very important to sort, that is help from, that is the parents as well as peer groups. So they can be guided just appropriately and immediately. So we have to sort actually there is the help from the parents as well as the peers immediately, so that they can be guided appropriately. Even you can get what we have, just the help from the close friends and also trusted friends. Getting advice, getting proper advice to deal with the problems or to sort out the problems, help the youth to vent out feelings, vent out, open out, vent out feelings like anxiety and then guilt. So they can vent out what we have to open out the feelings of anxiety and guilt. Then education and counseling. So education and counseling can create a positive attitude to solve or to deal with the problems. Okay, and also accept disappointment in life. So we have to teach them. So what are the things there? So we can accept your disappointment, ready for the next one to go. That is education and counseling. Look for danger sign. The teachers and parents need to look for actually sign. That is normally to indicate tendency of the individuals to go for or going for an addiction. So you can easily find out if there is any change in his behavior. You have to find out that danger sign to go for what is called actually addiction. So this is a mind of the parents and the teachers. You have to look, you have to watch the students indirectly. Is there any abnormal behavior, etc. Whether he is going to be addicted with the drugs. That is what we will look for danger sign. Indicate the tendency to go in for what is called addiction. Professional and medical assistance. So assistance is available in different forms, such as, for example, qualified psychologist, qualified psychiatrist, and for example, de-addiction and rehabilitation program in hospitals or in private centers, okay, to help the individuals to overcome their problems. So this is the assistance given either by the psychologist or by the psychiatrist or the de-addiction centers or rehabilitation, that is the programs to help the individuals to overcome their problems. So these are the different measures to prevent and control drug abuse and alcohol. So with this I conclude about the alcohol and drug use. We have to go for the mental health and the depression and the lifestyle disorders. What is the reason, how to overcome the lifestyle disorders, etc. in the next class. Thank you.